I guess as the foundation has been working in the field of community health and really looking at how might health become, or how might health systems be redesigned to deliver more towards the communities, and what's the role of the future health workforce, and what's the type of health workforce that we need that can deliver within communities in an expanded definition of health, taking into account social and environmental determinants, integrating the kind of physical, mental, emotional, and spiritual health. So we kind of within that inquiry phase of understanding what might be the role of a foundation in being catalytic towards a new way of approaching health that's more community grounded, that's more holistic, more integrated, more upstream, and takes into account all social and environmental determinants around citizens and not around patients. So it has a lot to do about being proactive and not reactive, sustaining good health and not curing diseases. So obviously, knowing that we're a corporate foundation attached to a healthcare company, it's not always an easy fit or an easy narrative to be having. But the way we see it is that we have funding at our disposal, and we have decided to stop working in a bilateral manner with different entities. And the reason for it is we felt that to be truly catalytic, we had to move away from just supporting financially delivery and implementation. And actually, one of the gaps that we felt was the most crucial gap was in the process of convening and ecosystem building, and something which I very often refer as collective action and impact. Now, the best way I've tried to put it in an image is we've all been working on our slice of the cake for a very long time, trying to change within our organizational mandate what's within our sphere of influence. Now, it hasn't really reaped the benefits and the change that we all were aspiring to. So having patient capital, so it's like, how can we use funding to also buy us patience and complexity? It's like, how might we lean in that complexity collectively? What's the space that's created that's kind of has the psychological safety to say it's okay to go towards complexity and try to work in a more systemic manner, and zooming out of our individual slices of cake, what might be a way we can all envision the cake together and not just the slices. And I think each and every one of you guys have a part of that slice, ingredients to the cake, skills and expertise that are contributing to the whole. Now, what I feel very often frustrated about is that we don't really have space to cook the cake collectively, to look at the cake collectively, to cook the cake collectively, to look at the key ingredients and how they intersect and the interconnection between the different slices and how are they mutually beneficial. And also eliminate some of the duplication that we see in the system. And that's why the foundation has really shifted gear, shifted the gear from having these bilateral funding to seeing how might we partly fund the convening and partly fund the implementation. Now, the convening, and those are just words of non-wisdom, the convening in my view has shown me that we are increasingly, yes, working within networks, but they're not necessarily, and I know I spoke about that with some of you, they're not necessarily networks attached to organization. They're very often attached to people, to their drive, to their passion, to their expertise. And probably we're moving towards a future where individuals will carry a lot of weight and power, and we're still stuck in the old models of working with organization. So what appealed to me with all the work that EHFF is doing and some of you are doing with Ashoka and others here represented, is that you're very much tapping in individual passion, and the aspiration with the TPI report was to start exploring what are the governance model of the future, and how does transformation happen, and what type of governance of collective action and impact may we lean into, or at least research as a kind of living laboratory. We may fail, we may succeed, and that's okay. It's like, how can we learn so that we keep convening individuals and organizations to come together and to kind of, you know, have that vision of that cake all together, and then decide, yes, it's overwhelming to hold that complexity, but it's also okay to feel that we have a sense of agency of only one slice of the cake. And that's probably where we will little by little shift the needle a little bit more. I hope that that helps all of us to feel hungry for more cake.
Thanks, and I forgot I should have given respect in recognizing you're coming to us not exactly from your sickbed, but you know, you're still recovering from another bout of COVID. So I'm very grateful, Marion. But yeah, that orientates us certainly, and it's very helpful. In terms of talking about our preliminary vision of where we go in a few months' time, after taking an outline to the J&J Foundation board. I mean, it's pretty obvious in some ways, isn't it? But I just want to emphasize a point. You know, what the whole notion, as I understand it, of transformational catalysts, and what we're at here is we want to understand the whole field as much as is relevant, and we have to start somewhere because it's so vast. So we're starting in one area, you know, the Anglophone part of Europe, and then we want to extend that. But and we're learning all the time about how to do this thing, because I don't think it's been done before in this way. And what we're looking at is something. In terms of transformational change, what we're looking at kind of, in my opinion, and again, this is evolving, is it's a kind of nudging process. It's about looking to where are the key points where nudging will make a difference. So it's looking at things that might otherwise not be recognized by some people, like the power of communities and what's going on at grassroots level. Because we know from if you know, someone sitting in a futures organization, when you try to scope what's going on and what's coming up over the horizon, it's just astounding how much there that you didn't know about, and it would be very difficult to find. We all have that problem because there's so much happening. But there are things that we want to facilitate, which you obviously have to discover, and this is again about the design process, isn't it? And then to make intelligent choices about where you try this out. So piloting as well as further scoping is part of where we're going to be, and having as big a network of partners who can support this and help us with the plausibility, it's a word, the scenario people use a lot, of the approach is going to matter a lot. I think that's really all I want to say about that, because I think it's much more important in the time left to us to actually have an open discussion and get people to share their view. So, John, do you want to start the roundtable?
Yeah, sorry, I don't want to start. I don't want to be the one that's always leading it up. But anyway, it was just something that came to my mind as well that I think is important in the whole process. And that is that the transformation has to be fit for purpose. All too often, developers and creators start coming up with all these imaginative ideas, but they're not fit for purpose because they don't necessarily understand the context that they have to work in. Absolutely. And I want to sort of draw back to something you had mentioned earlier, that I presented an institutionalized view of some of the drivers going forward. I would argue with you that they're not institutionalized views. We do know that there is an aging society. That's not an institutionalized view of the Commission. Yeah. And unless we're developing our health and care systems that actually provide for an aging population, but it's an aging population in what we in the RSCN define as within a whole life course approach. So yeah, you don't wait till somebody reaches an older age, you actually start earlier in the life cycle with them. And you look for those key points of change in their life cycle, and you start to do it that way. So it has to be something that, as I say, is fit for purpose. And if we don't really understand or haven't properly defined even the simple in terms of what is health that we're talking about. Is it health and care? If we don't examine the boundaries that we're wanting to operate within, and I think whatever to quote Marion there, in terms of looking for that governance model of the future and looking for the transformation models of the future, it will be hard to ensure that they are fit for purpose.
It's a point well made. Let's get others then who haven't spoken yet to give their reaction and contribution to the discussion. Who'd like to lead off?
Hi, this is Yulika from Ashoka. Not sure if I want to lead off or maybe piggyback off of what John just said, and what really resonated was kind of the entire life cycle. We have a fellow, and I don't know why his name is escaping me right now, but his organization is not. It's called Cycling Without Age, or in France here it's Vélo Sans Âge. And while he created this model to support aging populations to build social connectivity through cycling, he has really kind of expanded a lot of his thinking, and it's really at the level of, building systems for age 8 to 80, building cities for age 8 to 80. And I think in this context, it's building healthcare support from age 8 to 80. So I think there's an element of when we, thank you, Ole, yes, thank you. There's an element when we start talking about, governance models and transformation models for collective action in the health space, that I feel more and more we're moving away from siloing different patient segments and siloing different groups, and really recognizing a holistic approach of what it means to be an individual within a community, an individual connected to a community and beyond, and therefore building and supporting systems that help that kind of profile. I'm not sure if I'm being too kind of vague, but and so what I do like about the model that you guys have shared, the Horizon 2, and again, congratulations on a significant feat in work, is that you can start to see a little bit of that coming together of the diversity of profiles that are happening. I will say, as someone who has only been in Europe for 6 years now, that the Anglophone kind of view is going to be limiting until you start to open up that scope a little bit. But there's a lot that is transferable, I think, to other areas.
It's very helpful. Who's next? Looking around the room. Matthias, come on, I'm going to jump on you as an old friend. What would you like to contribute to the discussion? So yeah.
So interestingly, just Daniel asked me if I can contribute. And I told him that I have the tendency to give small tours in the way of my thinking and working. But I like to keep it simple. So we started to discuss how you see, you apply seeing first and then sense making. And then I was writing on my note, and how do you shift then? How do you do the shifting? How do you do the simplifying? How do you do the starting? And how do you do action? So we discussed these kinds of ways, and we have examples. And I have one example from Utrecht, which I work on as some sort of a change agent, a strategist, outboard engine, so to speak. And I literally mean a speedboat with a small motor, but the people in the boat decide the direction and decide the content. And I just chase them on moving into action. And it's just about act, reflect. So that's on a city level. And I just got a keynote in Norway on the Evolve Arena, the social inclusive cities of the future, where they combined 5 topics: mobility, sustainability, circular economy, health and food. I was on stage with Boris Johnson's brother, with the former minister of Sweden, and just me, a citizen of Utrecht. It was quite interesting. I have just 10 pictures of which I showed them on how to integrate all these different topics we are discussing about just in pictures, because I think it's about longevity as well. In Utrecht, we started 20 years ago to put health in all policies. The motto of this city is healthy urban living for everybody. That has been so for the past 15 years. And that makes something really clear, is that health is an option and health is a choice. Utrecht chose health first. Everything they do in policy in Utrecht is also assessed by what's the impact on health. And that means that they have made choices that are beneficiary for health or healthy urban living, instead of for only economy or mobility or accessibility or growth or anything. And I can show you some of those pictures just to have an idea of what that looks like in real life. And it's quite fast. It's like 5 minutes. I can do it in 5 minutes, David, if you allow me.
Well, look, actually, is it possible to, I want to give maximum time for, I think it's really nice that, but is it possible you could share them? Can you do it by putting slides in the chat or something like that?
I can do it, but then you have 10 pictures.
That's all right.
There's no text on the pictures.
Yeah, but do that. And that, I think that would be really good. Okay. Okay. But look, I want to give, I just want to give more space for other people to, I think it's really interesting, the point you make, and very worthwhile. But I think if you can share that material, that'd be really very helpful. Who would like to go next?
Just a note, I'm trying to capture in the chat box summary points that people are making. If I'm capturing them incorrectly or inaccurately, please say so, okay? I'm just doing my best with it, okay?
No one's volunteering. I'm going to ask Steve if for a reflection at this point. Especially when you got up so early in the morning.
No, I'm quite happy that you're going around the room. I'd be interested in hearing from the others too, David. So I'd like to give my time to them.
All right, by all means then. Okay.
David, can I come in? It's more with a question than anything else. I'm very conscious of well, certainly a good few of you mentioned at the start when you were introducing yourselves. You said, I'm originally from. Which really means that you have a beautiful richness of culture behind you. And I'm also conscious that a number of you are coming from different linguistic areas. So you would appreciate how difficult it is to translate from one culture to another culture. And yet we're stuck with this problem of we all have to communicate, and we usually communicate through English. I'm involved in a number of projects in Ireland where we're looking at the influence, the profound influence of our culture having been forced to live through English, and what that has meant to us. And we don't really even realize what the profundity of it is. So I'd love to put the question to you, as we want to move out from this Anglophone approach, which is obviously great because we can all talk. If we go into Polish or Czech or Irish or whatever, then we're only speaking to ourselves, kind of thing. But how do you think we can address that kind of issue in a really meaningful way? I don't know if anybody has any thoughts on that.
Can I say something? If anyone says Polish, then I feel like that I need to say something. That's very good observation, Sean. I was actually thinking about it recently, that I'm forcing everyone else that I'm working with, like change makers, to actually use English, because we do not share any other language at a sufficient level to communicate. And indeed, that's posing a lot of, I would say, problems or issues, at least. And one of them being that, especially when we talk about healthcare systems and transformations, we have to be super, super careful about what are we talking about. So basically, we have discovered that in terms of, I mean, it's probably you all know it, in terms of certain healthcare functions, even they sometimes exist in one country, there is no equivalent in another country, which makes it very difficult to discuss. Some roles, even some very common roles like a nurse, has actually a different meaning in terms of what the person is doing in, for example, UK and in Poland and in France. And as a person that transitioned together with her family when I was already an adult from one country to another, and Eastern Europe is, it's a different world, especially when it comes to healthcare. Sure. I have actually realized that the mindset is completely different. So I'm actually a huge fan of Dutch healthcare, but it was a really surprise to me, even though, you know, I'm educated in my literacy, healthcare literacy level, I perceive myself as quite high. The mindset of and the cultural frames of approaching a patient was so different. I really struggled at the beginning, because it was not about the level of service. It was just a completely different approach towards another person in terms of the hierarchy, in terms of the understanding and the values that were already in the system and they were rooted in the society, the values that in the difference between the values that are in the Netherlands versus Poland in my case. So that made me think that indeed following Cormac Russell thought, the healthcare is just an outcome of the society we live in. It's not producing the society. Of course, there is a relation, but that's, well, his view on working on communities is because he believes that, of course, democratic society and the community will essentially is at the bottom of the entire system, meaning that when you influence that, you would be able to essentially change healthcare system as well. My other comment on the language thing is that I think we quite often undervalue or we are not aware of the examples of changes and initiatives existing in countries where they are not described in English, which makes it largely inaccessible, at least from the knowledge, from the awareness point of view, to other countries, which doesn't mean they do not exist. They are just not described in English, which makes it difficult to be found. And for example, I'm aware, you said that there were no policymakers in this health transitioning. Well, I'm aware of the government of Flanders in Belgium that is funding via the Ministry of Health a very large initiative called Caring Neighborhoods, and introducing integrated community care into the healthcare system in Belgium. So it is existing, but because they are using different language, you probably wouldn't be able to Google or to use a desk research to find that initiative. So that's definitely super challenging and another level of complexity that I'm not sure what to do with.
Yeah, well, look, it's interesting, but you know, one of the things that we pride ourselves on in being a network of networks, you know, in EHFF is that we have a very diverse community of participants, so that the very points you make are extremely well made. But the fact is, you know, we have people from Czechia, from Poland, and so on, who have that expert, at the same time, contextual view, the cultural view, which allows us to, keeps us on our toes in recognizing those kinds of essential differences. But it's absolutely right. I mean, we did just for a second, we did a little survey on a topic we're very passionate about. Patient empowerment is, again, community empowerment, the whole notion of health literacy and so on. And we just asked in 12 countries in Europe, how do you use the term? And it was extraordinary, the variety, even though, you know, the European Commission had done a paper and there are all these things, but what people do in practice is so much context and culture driven, you know, there's no doubt. Who else wants to speak?
Sorry, me again, and then I'll
Sure.
stop talking. But again, wanting to jump in on this conversation, I think the other level of language and language barrier that doesn't, at least I haven't heard discussed as openly, is that we're not just talking about languages that are traditional to Europe, right? Because we have evolving and growing demographics, migration, immigration. And so you actually have to have kind of a global view on language and language accessibility when you're speaking about access to health.
Yeah, no, absolutely. Again, both in wider than Europe, but also even within Europe now because of migration, as you say. So I mean, we looking to health inequalities and about disadvantaged groups. This is something that's helped focus attention, I think, on just those issues. I mean, and there have been some lovely small initiatives that have happened recognizing this. You know, I think of a project we were doing with the Commission where someone in Finland was working with Somalis, people who were prone to diabetes type 2 because of all kinds of complex reasons, and working with them as you know, on their level, you know, sort of working with them as a community made such a huge difference, you know. But it's massively complex, all of that.
We have Marion, then Christine.
Great. Marion.
I think the conversation around culture, language, mental models, you know, specificity of the health system reminds us, or should remind us probably, of the danger of working in a very centralized way. And I guess a lot of the failings of the system is that centralization that has happened along the years. And that's also why you heard me before talking about this kind of more ecosystem nurturing, is how might we create a container or a frame that allows for that very kind of localization to happen and for the bottom-up approach to happen. I mean, to Jelika's point, health will be easier and at community level, specifically when it's represented by someone that speaks and looks like us. So, you know, what's that enabling factor that this particular partnership can also create a container, but really allow for that tailoring to happen so that we're not coming top down, but that it's creating safety and containers for more of a bottom-up approach. That would be my kind of reminder.
That's good. Yes, Christine?
Yes, thank you very much, and also for bringing up all these interesting points of views and perspectives. I think the way we also talk about language and so on in health is really about cultural sensitivity, and as I recall it, we had it as one of our points in the future diagram in our study as a major point due to all the reasons you have touched upon already. And my kids are blaming me that we come from a small country in Denmark, and then we moved 10 years to the Netherlands. So now they speak Danish and Dutch fluently, and of course a bit of English. But you know, what a gift to give your children that they speak the very small languages. But I think this is the way we navigate. EU has, you know, made an effort to always provide translation in 22 languages. And it's a big hassle, but on the other hand, I am also pleased that we do have English as a common denominator for many things. And yes, it has a flip side that there are lots of knowledge we can't access. And therefore also evidence is often biased because most things are published in English, and we should just keep this in mind. But globalization is here to stay also, despite not being able to travel. It's something that we need to bear in mind in everyday life. My other point is on a comment I think was said by David and some of you earlier on, is that the WHO definition of health is not wide enough to the way we want to embrace health. Actually, next week, WHO is hosting a conference on well-being, the World Conference on Health Promotion, and the well-being agenda will be discussed. And perhaps this is an issue that is also being brought up. because planetary health is certainly one of the main topics, and also the focus from health to include well-being in a much wider sense, I think is what we have already also identified in our study. I'll send you the link to the conference. It's still open for registration, and many thousands people have already signed up. So if you have the time, I really encourage you to bring all these points into the discussion next week. Thanks.
Thanks, Christine. Yeah, I've signed up. But yes, it's useful to have the link. Thanks.
Daniel, then John.
Daniel.
Okay, so first, Jellica, thank you very much. You reminded me that I was actually part of cycling without age for several years in London. I was cycling on my rickshaw with elderly people, which then turned into tragedy because of COVID, obviously. And then we cycled through transportation. But the point is, I've lived in London for several years. I actually grew up, went to school in Utrecht and spent many years living in Italy. And I'm convinced that although there's so many cultural differences, there's so much that these different communities in different countries have in common. And at the risk of sounding like a hammer looking for nails, as a designer, I think that design gives us common frameworks where each of these communities can then customize through co-creation, co-design, and so on, solutions that work in their community. And I think that's one of the things that we need to search for. What is this common set of methodologies, tools, and so on, that we can then help disseminate so local communities can actually configure this to actually work in their setting. So that's a takeaway from me. That's one of the challenges here, is to actually have a platform, almost a platform approach, and then allow communities to take ownership and configure this to something that's going to work for them.
Thanks, Daniel. John? So, yeah.
With my microphone on. Yeah, just want to echo the point that Marion was making as well, in terms of ecosystems and the important role that ecosystems make in enabling and facilitating the transformation and change. And that is the model that we are advocating and we push through the Reference Site Collaborative Network. Because what we say is that if a region or a municipality wants to become a reference site, it has to demonstrate that it already has in place or is working towards the implementation of the quadruple helix model, which brings together in the four quadrants, government and health and care providers in one quadrant, researchers and universities in the second, industry in the third, and civic society in the fourth. And the reason for that is to allow for that understanding across all of the stakeholders of what the key challenges are, and also to work together to develop and implement the solutions to those challenges. So within the reference sites and within the Reference Site Collaborative Network, we drive that strategic partnership, strategic alliance, ecosystem type model to make it happen by bringing together the key stakeholders. The other point that I would like to add to the discussion is that whenever we look at scaling up the best practice and the transfer of that best practice, and this is where we start to look at things moving from one region, country to another, it's about the adoption, not the adoption of what is the good practice. Because it has to be recognized that there will be cultural, regulatory, statutory, organizational differences across countries. But once we actually develop something that will address transformation in one country, it may not necessarily be able to be lifted and placed in another country. But the core principles of what was done and how the barriers were actually overcome are elements that are transferable. And that's where we can take and learn from what happens in one place and adapt it, not adopt it to another country as part of scaling up.
Certainly, you will all know, if you've been involved in quality improvement, even, that transferability is a key issue. Look, I'm looking at the clock.
We have one more hand up, which is Steve.
Yeah, I was about to. That's great minds. That's what I was going to just say. But first, let's hear from Steve before I do mine. Come on, Steve.
Thanks so much. I'll be brief, but just reflecting on the history of transformational efforts. Healthcare was really at the forefront, as I think of it, in the 1980s. And then with the growth of the environmental agenda, it receded in terms of the public focus. And I'm very appreciative of the Three Horizons focus upon that you've developed upon culture and movements. And I think that that is a very powerful focus. And it just brings into mind for me the importance of combining the healthcare perspective and the environmental perspective as a powerful strategy for the development of this agenda.
Thanks, Steve. That's very helpful. Look, I'm conscious that we said we'll finish in three or 4 minutes, and on the agenda is next steps. Really, all I wanted to say about that, though I'd invite others to comment if they like, is we've given you a snapshot of a process that we're involved in, which will go on, and it's developing as it does so. One of the things we will do is, for those of you who aren't already on the team, we'll go back to you individually and just have a discussion about what your interest is in, just to maybe be observers of the process or maybe participate or contribute. It'll be entirely up to you, but we'll have those conversations further, just as we will be with the half dozen other players that I mentioned in passing, as we, and the truth is, 6 months ago, we wouldn't have known that this sort of thing was happening. It is always an evolving process, but at least we've got a clear direction. I just thinking, just to indulge by talking about history, I was struck when John was talking about at the beginning about the fact that we're now looking at the whole life as opposed to just aging. That's a transformation in itself. I was watching the conversations in 2013 when the EIP, the European Innovation Platform for Active and Healthy Aging, was getting going, and there was no doubt at that time that the preoccupation was with the impact of the elderly on the whole ecosystem and how the health system had to adapt to those changes. I think things evolve all the time. Our thinking, just like, it's quite extraordinary how we were so healthcare focused, and now suddenly we're talking much more about well-being. We always talked about prevention, but couldn't somehow get people to buy into, to put the resources into thinking about better health rather than sickness care. But I think the whole understanding wellness properly, and again in the context of a healthy planet, is really something that's emerged just during the time that EHFF's been around, I think, and it's fascinating how that moves forward. Look, I'm very grateful for all of your time. Well, we are grateful, just speaking for the team, but would anyone else want to just comment as you go out the door? I'm quite happy if anyone wants to just say a parting comment, or should we go around the room, just have one sentence from each person, something like that? I suppose we could do that if you feel brave enough to do that. Ian, do you want to give us one sentence?
I've tried to capture everything in the chat box. Hope it's okay. No, great conversation. Great conversation. I loved it. One thing I would say is we had a conversation in the EHFF. I'm working with the Fix Our Food project in the UK, and they have health or bad health as an outcome of the defects in the food system. Major bringing those two things together, and that's surfaced in the call today. So I'm really pleased about that. That's me done. Do I pass on, David, or would just jump in?
No, I'll go around the room. Matthias, do you want to have one sentence to say goodbye?
Yeah, so it's, I'm doing a major different project in the Netherlands, and we are focusing now on livelihood. So how to get rid of debts and poverty as a major outcome on health. So that's interesting, how to measure health, experienced health, so to speak.
Great. Okay, Daniel, you want to have one sentence?
You're on mute, Daniel.
I said, oh, blimey. I think this has highlighted how necessary this is and to continue. We can't do this in isolation. We need to involve as many of you as possible. So thank you very much.
Great. Sean?
Yeah, just one of the highlights for me has been I make a link between this notion of getting down deep into local culture and health. And I know it's all very different locally, which we want to encourage. And the old model that we used to have in quality, which was that you come up and develop your concepts and then get back down into the fishbowl and see what's going on. So we might look at that as a cultural model for ourselves. Yeah. Okay.
Great, thanks. Noel, are you there? No. Whether the Noel's on mute or not. Okay, I'll jump us. No, we haven't got time. Marta.
Yeah, I think there is a lot out there, and I just hope that we will find enough examples instead of reinventing the wheel, and find a way how to pull those examples together to essentially make this significant change.
Thanks very much. Okay, Christine?
Yeah, thank you. I think my take-home message is also that we are able to work together so many different disciplines. We keep asking for more multiple disciplinary work and cross-sectoral approaches. And I think if we can make it work in this group, then it's a good example for everybody else. Thanks.
And I see Noel's back on stream now. Quick word, Noel.
Yeah, my system is really failing me. I pressed the button as soon as you call my name, but I just think it's great to hear different voices, very different views, perhaps, and where we think we've been going. I was also conscious that I think if you asked a politician about their vision for the future, they'd say bigger, better hospitals, and no one would have dreamed of putting that down from this group of people. So I think that says a lot too.
Okay, thanks. Yelika?
Well, I think we need bigger, better hospitals. And no, I'm just joking. No, I completely agree. I thank you so much for allowing me to be a part of this conversation. There's so many synergies, you know, between what we are hearing here, how we're looking at health from the Ashoka standpoint, and then also, I don't know if I mentioned it, but I'm also on our Making More Health partnership with Boehringer Ingelheim Pharmaceuticals. So there's a lot of opportunity, I think, for future collaboration and connection. So hope to stay connected. Thank you.
Thanks. John?
Thanks very much, David. Just want to thank you and colleagues for giving me the opportunity to come along today and to contribute to the discussion. And I think it's important as we look towards this transformation. It is transformation that is moving away from a service that is delivered through structures to one that is actually delivered through systems, with the patient, the citizen, and the service user at the center, and everything developed around them and their needs.
That's great. Thanks, John. I think we lost Marion because she had to go to another meeting, but Steve, this last word.
I want to express appreciation to EHFF for its persistence and holding of this effort over such a long period of time. It's critical to any transformation effort. And also for your final comments, in particular, David, about well-being, which I think is the unifying concept, that there's a set of values behind that that I think is the basis of what we're working on. Thank you.
Great. Ella.
Thank you for the conversation, and thank you for allowing us to be part of it. Because as Yelika said, it just resonates with all that we've been discussing, and I'm just seeing the expertise in the room and the appetite for really pushing for a big change. And I'm just thinking of how can we start and how we can really catalyze that together. So yeah, I'm very curious to explore this more. Thank you.
That's great. Well, we will certainly do that. Look, thank you everybody very much for your contributions. It's made it a lively couple of hours, and but maybe it's time to move on, and we'll meet again. Thanks very much.
Okay, David, thank you.
Thanks, everybody.
Bye, everyone.
Bye-bye.
Bye.